All right, so here we go. This is the agenda. This is what we're going to talk about. Maybe in the next 20 minutes or so, we will certainly have enough time also for your questions. Also, please feel free to ask questions in between if they're on that specific topic on the slide. And also afterwards, we'll have enough time for Q&A or discussing certain topics. So I will start briefly with introducing why investing in health tech is interesting in general, especially for business angels who have experience in that space. We will discuss a potential investment strategy that is relevant for business angels, and then our MEDKAP approach. And finally, of course, as I mentioned, we will then dive deeper into digital health investments, where Markus will briefly explain again his thoughts on this topic. So, Markus, would you like to introduce yourself now?
Of course. Hello, everyone. Alexander, we've been in touch already on LinkedIn, I remember. So we know each other. So great to have you on the call. So my name is Markus Böttler. I spent my entire career on the services side for pharma. So I would say I know pretty well how successful product launches in regulated markets work. And I'm using my experience, my extensive experience in commercial excellence to advise digital health startups, health tech startups in go-to-market and commercial excellence. And we're going to talk about that with a specific focus on the German DiGA market a little bit later.
Great. Great to have you, Markus. Thank you. Briefly about myself, I have founded MEDKAP Investor Association together with Jan Filcher, and also founded Capsly. The motivation to start MEDKAP was actually because we noticed due to our report that we're doing, the funding report for Swiss health tech startups, that there are not many pre-seed and seed investments, which basically means there's not much business angel activity. And Jan basically had that experience how to build business angel clubs, and I brought in the network from the healthcare space. So this is how we started, and in the meantime did 5 investments. I have a business background, however, I work in medtech since 2011 and have built a product management department, analyzed new product ideas, and also accompanied many product launches globally. And that's basically it about me. I worked also at a startup, a very big company like B. Braun, and I wanted to help health tech startups and innovations to come to the market faster and more successfully, and this was my motivation to launch Capsly and MEDKAP. Great. So why is health tech an interesting space? And in general, healthcare is a very much growing market, growing year over year, also with the growth of the population in the world, obviously people having more and more access to healthcare. And so that's why it's quite a crisis-proof market, one can say as well. And I think the time we're in right now with the new technologies just make it really exciting, and it's like AI or telemedicine that are really disrupting the current healthcare system as we know it, and provide the possibilities for new solutions that make healthcare more efficient and more accessible. And so I believe in general it's a very interesting time like we probably didn't have in the previous decades. So this is just also something we should probably be aware of from like a big picture view. And of course, it's also a nice way to create returns while also contributing to healthcare improvement, or some consider it as like impact investments as well. All right, let's come to an investment strategy. Why do business angels invest into startups? So why do they even are active in that space? And together with Jan, I've discussed it, and we came down to these 2 main things. He's a business angel for the last 20 years, and he said basically it's about, having fun with startups because it's cool working with really motivated entrepreneurs who sort of want to change the world, who want to have impact. But then on the other hand, of course, you also want to make money, right? And so we said, okay, we want to focus on this intersection and focus on those activities and make it very simple, more or less. So making money with startups is not so easy because you might be familiar that many startups fail or at least do not provide a significant return. It's not necessarily true that 90% of the startups fail. It's more like 50% that certainly fail, and the rest somehow survives but doesn't provide significant returns for the startups. But the 10% provide significant returns for the whole portfolio from a VC perspective. So that means that the investors, they have this power law problem, basically, that they need to make really a lot of investments to find those few cases that create those big multiples. Yeah, and you can see the curve here. So you need to have around like 100 investments to maybe hit like one unicorn investment. And of course, that's a challenge, and especially a challenge for business angels as well. So you can see the multiples that are returned. The multiple is the multiple based on the initial investment. So if 1 million was investment and that returns 5 million, it would be a multiple of 5, right? So this is what is meant here with the multiples. And the problem here is that it depends on the number of investments, and this really means that you should either make a lot of investment or try to increase the multiple of each investment, right? And that's also a challenge for a business angel because you cannot take care of all the startups maybe that you need in your portfolio. So how can you have fun with startups? So this is also something actually already like a proposal from us, that you actively invest into 2 or 3 startups where you also have enough time to accompany them, to maybe be active as a board member or advisor to the startup, where you know the industry very well and can really help them with the network. And basically focusing on getting customers, focusing maybe also on getting investors, but also having the exit in mind very early on. And it's also fine to earn some money if you're bringing them customers, for example, and things like that. But it's not necessarily advisable to be in day-to-day operations because then you're maybe too deep into it. So it's sometimes really also helpful to keep that big picture view. So a potential investment strategy could be that a business angel makes a few small ticket investments into a large number of cases where there is a good lead investor. And if they are the lead investor, that then they really become active. So to have a mix of active and passive investments, which is something we want to enable at MEDKAP, which is possible through our syndication approach. Basically, that allows small investment tickets to our members so that they can make those passive investments as well. So, for example, you had a yearly budget or so of 100,000. One could make maybe 2 active investments. 15K is not really so much either, and 14 passive investments with 5K. So that would be sort of a maximization strategy, that you really build a large portfolio within a short time, right? By keeping the tickets very small. The tickets per startup, of course, can be also much bigger than this. But the idea is to get to over 10 portfolio startups rather quickly. That's basically the idea, to also diversify the risk. I've already mentioned a little bit about the syndication, so I'll come to that later, but I also want to provide to you this overview of the ecosystem that we're building. I've mentioned that I've also founded Capsly, and MEDKAP is sort of, one could say, a spin-off from Capsly, because we founded this due to the need for more business angel activities. And MEDKAP is sort of also a first step to help pre-seed startups, to provide smart money, to give them access to the network and the senior experts in the industry. And what we have also noticed is that most health tech startups don't really have commercial expertise in their team. What we see at MEDKAP is that about 80% of the startups don't have anyone with commercial experience in their team. And then, of course, it's also a challenge to find someone commercial to have the money to afford them. And the commercial activities are also very broad, so that one person can cover all of those areas is also unlikely. So this is why we're providing the CCO as a service. And more on that on another day. We actually have a webinar with Kai on this in 2 weeks. But what's also important to mention here is that corporates play an important role because usually they are the main exit partners in health tech, and also very important distribution partners, and they can also certainly benefit from the innovation from startups because of those technology disruptions that we are seeing right now. And often they don't have the expertise in those areas like AI and digitization and so on, where they can really benefit. And this is where we're also trying to build the bridge between the startups and the corporates. Good. So why is MEDKAP different? I've already explained that we're using the syndication approach, which means that we're pooling the investments from all the investors. So there's only one entity on the cap table of a startup. So that's also a great benefit to the startups. But this really allows these small investment tickets. We focus on health tech only, and we think that's also really necessary because we can see in our membership base that really everyone has a healthcare background, and that really also differentiates us from other business angel clubs that don't have this. And it's also feedback we get from the founders that the input we provide through our process is super valuable to them. So we hear that really from many founders, which is nice confirmation of our work. Yeah, and I've already mentioned how we can also support operationally to make sure that those startups become successful. So we are trying to combine the strategies with like having fun with startups and being able to support them and make them successful, while also enabling to the investors to make money and build a diversified portfolio. We have quite a well-structured investment process. So we make sure that we always invite the most promising startups to our event. It's just to give you a brief overview here how this works. So startups apply. We have the jury review where Marcus is heading those activities actually. We have the pitch events. Next one is December 10th at Zürich in Schlieren. And then afterwards we discuss where there is the most investment interest, and then move forward with a deep dive call and due diligence, and then set up the syndicate on Leva, which is our syndication partner, who manages the whole contracts and the money transaction and so on. You will see this thing quite often, the spider chart. Those are the 6 criteria how we are rating the startups. Those are pretty much the success predictors. And every jury member is rating those from 1 to 10, where 5 is the average, 10 is more or less unachievable. This red line gives you an indication about what is the average, and the inner line is the minimum, and the outer line the maximum. So I also see how much divergence there is between the opinions of the jury, or if they're very much aligned. This is the team. So together with Jan and Max, I founded MEDKAP, and then we're very proud of our advisory board, where Marcus is a member as well, especially heading the jury activities, which is very important that we're selecting the right startups. And then we have support from other members who help in the jury and with other activities. So with that, I would hand over to Marcus to share a few words about his 3 serious blog articles, starting with the DIGA market in Germany to provide an overview. And you please let me know when I should change the slide.
Maybe we make a short break for questions first on your first part, Vincent. Yeah. Anyone questions so far? All right. Just wanted to give you the opportunity to discuss any questions you might have. So I'm working heavily in the German digital health, particularly the DIGA market. For those of you who are not familiar with the German DIGA system, so basically these are digital therapeutics on prescription. So doctors can prescribe digital therapeutic applications, and they are reimbursed through the statutory health insurance system in Germany. That was introduced now 4 years ago, and well, obviously there were high expectations from investors, from DIGA manufacturers, because they thought, well, it's an attractive market. You know, the product is reimbursed. Patient doesn't have to pay anything out of pocket. Doctors must love it and will prescribe it like hell, and we are all making a lot of money and getting rich. reality after 4 years, unfortunately, is that it's not so easy, and many of the DIGA companies are struggling to achieve the prescription numbers they initially thought they would get. Has several reasons. Obviously, there are structural reasons because the prescription process is very complicated, and there is a lot of loss of prescriptions in the early steps of the process. And on the other hand, you have to say, with currently 56 reimbursed DIGAs in Germany on the market, the approval process that has been created seems to work. I mean, if you get 56 DIGAs on the market in 4 years, I think that's a great achievement. And countries like Austria, we spoke about France, Alexander, with the Pecan scheme. They kind of, you know, look at Germany and copy paste what we have done, with obviously with local adjustments with regards to regulatory and reimbursement. But basically, the German DIGA approach was a blueprint for other countries for the reimbursement of digital therapeutics. Just to give you a quick overview on, you know, the general pricing and the landscape of the DIGA market. So generally speaking, we're looking at, you can skip to the previous slide. Thank you, Vincent. We're looking at a 12 weeks or 3 months treatment period for one prescription for the vast majority of the DIGAs. And the funny thing is, that is also always criticized by the health insurances, is that for the first 12 months, the DIGA companies can kind of, you know, set the price as they want. Yes, they do, some maximum price rules apply, but the process is set up in a way that for the first 12 months on the market, the DIGA companies can select their own price. The price is between 500 and 600 euros per quarter, or for the 3 months treatment period for the first 12 months. And then after the final admission to the so-called DIGA directory, the DIGA companies need to enter into price negotiations with the Association of Statutory Health Insurance Funds. And then the average price is between 200 and 250 euros, which is then the final reimbursement price. So it's less than 50% of the initial price. And this is also one of the challenges in the German market. Initially, comparatively high price. And then after 12 months, or beginning with the 13th month, you have a comparatively low price or lower price. So this obviously impacts significantly your commercial business model with regards to, you know, ratio customer acquisition cost versus customer lifetime value. Because the interesting thing is that DIGA primarily is a one-off product. There is not many repeat prescriptions. The average repeat prescription rate is like 13%. So that means growth and maintaining the revenue level can only come for most of the DIGAs from permanently new patients. You sign on to your DIGA respectively. You convince doctors to prescribe DIGAs to new patients. So you can imagine, if your source of business is primarily new patients and not so much repeat prescriptions, then this has a significant impact on the required investment for sales and marketing, because you need to keep the sales pressure comparatively high. If you look at a standard drug, for a pharmaceutical drug for a chronic disease, patients get repeat prescriptions for like 6, 12, 18 months, 24 months, etc., etc. So you can keep or you can kind of balance the sales pressure and the sales investment you need to make to maintain your revenue level and to generate incremental sales. So if you look at the table, you see the number of prescriptions, respectively. Actually, it's redeemed activation codes, because the system in Germany works in a way that the doctor prescribes the DIGA. The patient needs to take the paper script, submit it to his health insurance. Then the health insurance issues an activation code, and only with the activation code, the patient can then start the therapy. And you can imagine that in this process, a lot of prescriptions a doctor actually writes gets lost on the way until the patient finally starts the therapy. There are estimations that 50 to 70% of the prescriptions are lost, kind of lost in transition from prescriptions of the doctor to actually patient starts the therapy, which is also the trigger for payment from the health insurance to the DIGA manufacturer. So if you look at the numbers of prescriptions, so the market leader Zanadio, which is a DIGA for obesity, market leader in terms of redeemed or activation codes, started with 6,100 redeemed activation codes in year 1. Year 2, they had 22K. Year 3, 28K. Year 4 will probably be around 30, 32K. So you see that the growth rates are significantly leveling out after like 3-4 years. So prescription tripled from year 1 to year 2. Then you only had like plus 30% from year 2 to year 3. And what we hear from the market is that probably they will end up with something like 34,000 prescription in year 4, which means that it's roughly a plus of 10%. So it seems that the plateau of prescriptions or market penetration is already more or less reached for the market leader, with around 30,000, 35,000 prescriptions, respectively, growth rates are comparatively. So what does that mean from an investor's perspective? If you take Zanadio, so their price is currently 218 euros, which is their reimbursement price, which includes German VAT. So the net revenue is even less. So if you take like make it easy, it's 200 euros times 30,000 prescriptions. So their annual revenue is 6 million. If you look at the costs they need to deploy in order to generate this revenue, just simply by looking at the number of employees at LinkedIn or whatever, in the previous days they advertised that they had 150 plus people. After they've been acquired by Sidekick, it's probably less than that, maybe 80 or 100. You can imagine that even the market leader with this one product with 6 million revenue is probably not profitable after 4 years, or maybe around break even. So from an investment perspective, I think that's an important information and an important point to consider, that only companies that really manage in a very lean way to develop and deploy a go-to-market strategy that is really ROI focused has the chance to become break even. And I would say, you know, being maybe break even after 4 years as the market leader, well, is not super performance. Any questions so far or comments?
I mean, I guess this is now mainly with your experience from Germany, because this DIGA principle is a very German thing, right? So what is your kind of estimation regarding Switzerland with, you know, I don't know, 10 times smaller market makes it even more difficult to use? And additionally, something like this DIGA framework, which at least as I understand is not yet available in Switzerland. I think there are individual agreements with some health insurance companies, whatever. But given that the smaller market size plus this kind of DIGA framework is missing in Switzerland. Do you think this is feasible at all for startups in Switzerland in this area?
Well, I would answer that differently, respectively rephrase your question a little bit. Obviously, this cannot be transferred to the experience we have in Germany cannot be transferred to Switzerland 100%. But what we can learn for digital therapeutics in general, or health tech in general, is how important go-to-market and commercial strategy is for building a successful company. If we look at the deal flow or the startup pitches we see at MEDKAP, the vast majority of startups, and this is also the reason why they fail, regardless whether they are DIGA, digital therapeutics, or health tech, is that they are missing commercial expertise in their founding team. They have very often no idea how difficult it can be or how long it can take to convince a potential customer. Very often you would see in the pitch decks. Let's take a generic example. You have a product that might optimize a workflow in a hospital, and instead of trying to really understand the use case in the hospital and where really value is generated in a hospital, then the founders just generically say, yeah, this is a great product. Hospitals will love it because they will save time. We expect that our market share will be 5% in year 1 and 10% in year 2 and 20% in year 3. And that's the basis for their business plan, without even thinking about, how does the buying center in a hospital look like? Who owns the budget? Who needs to be convinced? Does it really provide value to a hospital, or is it just our internal view that we think it's a great product? And to come back to the German DIGA case, the reason why most of the DIGA companies failed in the first 2 years is because they were founded by doctors and software developers. That's a great combination to develop a product. That might be also a good combination to convince investors, but that's the worst combination to bring a product to the market because nobody has ever done it before in a regulated market. And their initial thought was, the German market, that, we have a digital product, we're going to market it digitally. So they hired the wrong profiles. So they hired people with a SaaS and performance marketing and maybe FMCG background in order to set up performance marketing and direct to consumer and direct to doctor electronic communication systems. But they didn't work because doctors can't be convinced in the majority with digital ways, with digital channels, to prescribe a completely new system of treatment. You need to build trust. You need to explain the process, etc., etc. I mean, that's the same. That would be the same if Steve Jobs would have said, I've invented this great smartphone. I'm only marketed via text messaging and cold calling. That's the analogy I always use. And I think this is what the digital health founders across countries and markets can learn from the German DIGA system. Particularly if you're dealing with health tech and digital health, with regulated market, with reimbursement, etc., etc. You always need to keep in mind, who is going to write the check? So who pays for the product? How long does it take to convince the buyer? What value do you create on the buyer side? These are from my perspective, the 3 major points 90% of the health tech founders are neglecting. And this was also the case for DIGAs in Germany.
Marcus, could I ask you a question? Is it okay?
Of course, Kai.
So, or at least one, yeah. So the first one really is, we all know how difficult it is to get new customers. And you mentioned in the beginning the repetition rate. So, but all the diseases here of those top are chronic diseases. why is that you get a prescription for the second or third time? Why is that rate so low? Yeah, because I mean, these are all obesity, back pain, tinnitus. These are all diseases, you know, they do not disappear normally in 3 months.
Yeah. Well, obviously there are different explanations, and the 13% prescription rate is an average across all indications. Talking about Sanadio, so they have, for example, in obesity, they have a repeat prescription rate of 34%. So, you know, that is closer to what you would expect. But if you look at most of the mental health indications like depression, anxiety, agoraphobia, social phobia, etc., their repeat prescription rate is close to zero. And there is a reason why. Basically, two reasons. Initially, the DIGAs have been built for this 12 weeks or 3 months treatment period. You know, and after these 12 months, there were no new modules or there was no new content in the DIGA that would make sense for a patient to use it longer than the 3 months time, or for a doctor to prescribe it longer for the 3 months time. That was mistake number one. And number two is particularly for mental health. The challenge was, from my perspective, that all the providers, all the DIGA manufacturers, they positioned their product wrong. They positioned it as a bridge therapy, a bridge option for a doctor to prescribe to a patient before he gets personal therapy. Waiting times for a therapist in Germany are between 12 and 16 weeks. And all the DIGA companies positioned their product as the perfect tool to bridge the waiting time for the patient. That was convenient for the doctor because he had something to give to the patient. That was good for the patient because he could do something in between while waiting for an appointment or to start a therapy with a therapist. However, that obviously restricted the use and the repeat prescription for mental health. And this is the reason why particularly mental health DIGAs struggle so much, because they only get one patient and then they need to find a new one.
Mm-hmm. Those 2 points are very interesting, I believe. I was wondering about the first point you mentioned. They do not develop further features or so to keep the patients engaged.
Yeah.
Normally, with medical device regulations, you would have to make a design change request and then change the approval slightly if you're building new features. How's that with DIGAs?
It's exactly the same. If you look at kind of the mode of actions of DIGAs, you have typically two general approaches. You have cognitive behavior therapy elements, and you have lifestyle change DIGAs. Obviously, you would see a lifestyle change DIGAs is very obviously obesity, diabetes, high blood pressure, etc. Those are kind of the lifestyle change DIGAs, and they are generally easier to design for repeat prescriptions, because you can imagine if you want to tackle high blood pressure with lifestyle change, then what do you need to do? You need to get on a healthier diet. You need to work out, exercise more. You need to reduce stress, etc., etc. And that's something that is typically not done within 3 months. So, from a conceptual, from a therapy development perspective, lifestyle change DIGAs have better potential for repeat prescriptions, because you can design the modules in a way that they can be used longer than 3 months. If you take typical other DIGAs like mental health, or take tinnitus or whatever, you would have very often a patient diary, where you can log your symptoms or whatever. You have a little bit of disease education, and you have a few modules of cognitive behavioral therapy training exercise elements. And if you design these elements for a treatment period of 12 months, after 12 months, the patient is done with all the modules. what would you offer the patient for the next 3 months in a repeat prescription other than the patient diary? Because the key element is already completed, you know, the behavioral therapy modules. There is only limited attraction for a doctor and a patient to continue using a DIGA like that longer than 3 months if the major part is already completed after 12 weeks.
Yeah. Great. We have
maybe I can also give you
of course
examples from another disease area. So we are specialized in cardiovascular diseases, specifically after heart attack, and in there usually the patient is facing a variety of risk factors, from needing to move more, needing to change their nutritional input, needing to fight fear. So there's a lot of things which you can do which take a lot of time. So for us, we rank our patients' priorities, and based on the most pressing risk factor, they start to work on those. But usually after three months, they still have other risk factors which are worth to work on and which have also the clinical benefits if being reduced. So for those instances, for those disease categories, you have more to do for a longer period of time.
Absolutely, absolutely. If you go to the next slide, Vincent, please.
Mm-hmm.
You can see I've developed kind of a framework that can serve as an indicator for the commercial attractiveness of a DIGA, because I think that's what most of the companies also neglect. Most of the DIGA companies, they do neglect the indication. So they spend, you know, just to give you an idea, if you're starting to develop a DIGA from scratch, you're probably looking at an investment of 1.5 million. You know, if you're looking, you know, development of the therapy concept, then you know, building the software, all the approval stuff, you're looking at 1.5 to 2 million euros investment to build a DIGA. And if you're investing that on a nice to have, or very often you find, you know, a purpose indication that the DIGA founders think are good to have and good to help patients, from an investor perspective, I would always challenge that, because from an investor perspective, what is relevant and important is that the indication is commercially attractive. And when is a DIGA indication or digital health indication in general commercially attractive? You need to have a high unmet medical need or burden of disease. So there are only limited non-digital therapies, you know, like drug therapy or psychotherapy, or there is a high burden of disease. Then you have a comparatively small doctor HCP target group, because it's a difference. If you look at Germany, if you need to target 60,000 GPs, or I don't know, 3,000 urologists, that's a completely different story. Then obviously and we talked about that a little bit, from the DIGA mode of action, it's better if you have a mode of action that leads to a direct positive patient perception within the first weeks, even if possible. That depends a little bit on the indication. Obviously, that's more difficult for lifestyle change because that typically takes time. And you need to have an addressable patient target group. What does that mean? So the patients can be reached. They are aware, number one, they are aware that they have the disease, because you could also find, you know, like mental health or whatever, some other diseases where the patient is not even aware that he would be able to benefit from a DIGA, and the doctor needs to be able to also address the patient. As an example, you know, particularly for the addressable patient target group, we've seen from the data on DIGAs that almost 3/4 of the DIGA users are women. So why is that? Because from health psychology studies, we know that women are more open to health and to self-care, etc., compared to men. And so obviously, if you have a DIGA that is primarily targeted to a male patient audience, that's a challenge by itself. Then with regards to a high unmet medical need, burden of disease, my favorite example is always high blood pressure. The thing is, if you have mild to moderate high blood pressure, very often as a patient, you don't even have symptoms and don't know that you have high blood pressure. And you then go to the doctor, and the doctor diagnoses you. He can easily put you on very cheap generics that work very well, have no or limited side effects, so you can manage blood pressure easily without having to go through the pain of lifestyle change with a digital therapeutic. Also, if you take high blood pressure, the HCP target group are primarily GPs. You know, that's a challenge to target the handful of German GPs in a universe of 60,000 who are open to digital therapy. And also then the immediate patient benefit is very difficult, because if you look at lifestyle change, that takes time for the patient to feel better and to manage high blood pressure. Excellent. I also give you a positive example, because I think it's important to understand the relevance of the indication. That would be, for example, overactive bladder in women. So that means these women need to go to the toilet for like 10, 12, 15 times a day. That's a high unmet medical need and a burden of disease for the patients affected by overactive bladder. And there are only limited drug therapies. They very often don't work properly and have side effects. With regards to the target group, it's, you know, urologists, gynecologists is a comparatively small target group. The target group are women, and they have a high unmet medical need. So they're easily addressable also by the doctors, because typically doctors can't do much about it. They can say, do you want to take this medication? It has side effects, and the patients very often say, no, I don't want to try it. Is there something else? And if something else is a DIGA, that's excellent. And then you have the immediate patient benefit through the mode of action of a digital therapeutic. That's also, you can also tick this box, because overactive bladder, the reason is a miscommunication between brain and bladder. And this can be easily addressed with cognitive behavioral therapy exercises. And so the patients would, within the first 8 weeks or so, in the 12 weeks of the DIGA prescription, they would immediately feel better, because instead of 12 or 15 times a day, they only need to go to the toilet 5 or 7 times. And there are clinical studies in OAB DIGAs that support that. And that's also the reason why currently in Germany, I know of 4 DIGAs that are DIGA companies that are developing DIGAs for OAB, simply because it's an attractive market.
Great.
So choose your indication wisely when you're developing a digital therapeutic.
Absolutely. I think this chart here really provides a nice overview, and probably everyone working on a digital health startup should consider those 4 factors.
And if we go to the last slide to wrap the discussion up,
yeah.
I mentioned that already. From an investment perspective, I would always look at the founder team and the management team they have deployed, whether they have a commercial first mindset. Very often in digital health and health tech companies, you find a purpose first mindset. From my perspective, that's not a good thing to have. I mean, purpose is important, but if you don't make your company commercially successful, purpose cannot be achieved. That's the reason why I would always prefer commercial first mindset in founder teams. We talked about the therapeutic areas and the indications, and all stakeholders, the founders and the investors, should have a clear and common value creation strategy up to exit. That can be different. If you look at digital therapeutics or DIGA companies, that can be we want to become profitable as soon as possible, or we want to build a global company, so we want to expand internationally, or we want to sell the company as soon as possible and as profitable as possible. I think the value creation strategy and the exit strategy needs to be aligned between the founder team and the investors. That's very important.
Absolutely. I can very much also confirm the first part, that what you mentioned about purpose driven, etc. I mean, finally having impact and achieving this is basically through commercial success and reaching as many patients as possible and scaling the business. And that's also only sustainable if there are good profits.
To elaborate on that a little bit, I've been running a poll on LinkedIn in my digital health network earlier this year, asking the DIGA and digital health founders what they think is important for a DIGA or for digital health therapeutics. And one of the basically the two options were purpose creates profitability or profitability enables purpose. And unfortunately, 2/3 of the DIGA founders thought that purpose creates profitability instead of profitability enables purpose. And this kind of shows you the mindset of many digital health founders. That they all think that purpose is the most important thing in the world. Unfortunately, it's not. Creating a profitable and sustainable business is important. Only then you can have purpose, you can have impact and create purpose with your company, because otherwise you will disappear from the market in 2 years, and then there is no purpose and no impact at all.
Absolutely. I hope the background noise is not too loud for you. There's the kickstart ceremony going on right now behind me. Let's come to the conclusion here, or to the final slide from me, especially for Michael. If you're interested in joining MEDKAP and figuring out how this works, who are our members, you can join one of our pitch events. The next one is already in 2 weeks, 10th of December in Schlieren at Zürich. Zürich is an engineering company, and they also have a VC fund who we are partnering with for this event. And then it's a good opportunity for you to see how we are running those events, see which startups are pitching. We have selected 4 startups, and get to know more of our members. And then you can become a member for 2025. The yearly membership fee is 500 francs only, and you will basically have access to the whole deal flow, to all the events, and get invited to our investment syndicates, where you can place those small ticket investors and get also those insights and learn from other members, because of course everyone is from healthcare, but it's still a very broad space, and one cannot be an expert in everything, and sometimes also needs to rely on the expertise of the members. Great, so that's it from my side. Are there still any comments or questions? I'll stop the